guys, Amanda here. Today I just wanted to share with you my top 10 stretches for your back pain during pregnancy. So a lot of women will get back pain during pregnancy, and there's no mistake why. You have all this extra weight growing on the front. A big issue though is posture. So a lot of us have poor posture. We're allowed that low back to arch, and we're allowed those shoulders to round. So keeping good posture is one of the best ways, obviously, to help it out. So pulling your belly button in and up will help keep a neutral spine. When it comes to those rounded shoulders, the reason for rounded shoulders, a lot of us spend a lot of time driving a car, sitting at a desk, on the computer, and we're always rounded. So a lot of people, whether you're pregnant or not, will get long in their rhomboids and in their lats. So their muscle gets lengthened, it gets weaker. And then in the front, our pectoral and the chest here will get shorter because we're always in this position. So that's what creates that. So doing strength training on your lats from day one is the best way to prevent the pain in the first place. So things like rows, anything like that, or like a lat pull down if you're at the gym. So strengthening the areas is obviously the number one way to prevent it. The hip area as well, again, because we're sitting down so much, our hip flexors get tight, so it gets in this tight position here, and then it also pulls that back out of alignment as well. Strengthening your glutes and your hamstrings as well as your core will also help with the back pain as well, or your poor posture. But those are your strength training ones. I'll probably make a video for the exercises. But today we're just going to talk about stretches. So if you just need a little bit of a relief, again, stretches alone are not going to help with the back pain. You need to do some work to alleviate why you're getting back pain in the beginning. So one of the stretches we'll start with is a cat pose. So a cat pose is when our hands are underneath our shoulders and our knees are under our hips. You're going to pull your belly button in, and then we're just going to press into the hands. And that's now rounding through the back so that we get really tight in that, especially that upper back. It gets quite stiff. So this is a good one to get rid of that stiffness. You don't want to relax too much in this position. So when we lower down, you want to come to a neutral position, and you don't want to let your belly drop because, again, there's already a lot of weight on that low back. We don't need to pull it out of alignment. So just coming to neutral and then pushing it back through. The other exercise for that stiff upper back is your thread the needle. So thread the needle, you're in your same starting position, but you're going to get one hand and you're just going to put it all the way underneath, and you're just sliding down and then aiming for that shoulder toward the mat. Depending on how stiff you are in your upper back will depend on how far we can go. We're not nice and symmetrical, so one side is probably going to be harder than the other. So whatever side is tighter, you can just hold it there for a little bit longer. Pelvic tilts. There's a number of ways you can do a pelvic tilt, and it's really just this tilting position, and we're going to go side to side with it. So one I like, especially for pregnancy, again, we're in that same hand-knee position, is we're just going to twist our hip or direct that hip towards your shoulder, and then you're going to switch it to the other way. So if you imagine you're a dog and you're wagging your tail, that's what it is. So it helps stretch that back a little bit and loosen it up. So we're just going hip towards your shoulder and then hip towards your shoulder. You can do this while seated as well, like in a chair. Stability ball is really a good one as well. Getting that movement in the low back, especially if you're having any low back pain. One to target your hip flexors. So if we're tight all in here, is your runner's lunge. So a runner's lunge or hip flexor lunge, you want to have your knee, it should be over your ankle as we shift our weight forward. So my back knee is stacked under my hip, or it should be, and then I'm pushing all of my weight forward. Again, I'm not arching, I'm not leaning back, I'm sitting up nice and tall, and I'm just pushing my weight forward. Make sure that you're keeping your knee over your ankle. It's very common for people So start in this position, then shift the weight, and then you have all this pressure in your knee. So now we have knee pain as well as back pain. So make sure you take a decent step forward, and as you shift, your knee should still be over that ankle area. There shouldn't be any pressure in that knee. So if you're feeling any pressure in it, take a little step forward, and that should help with that one. What else? We've got figure 4. So this one you can do 2 different ways. At the moment, again, because of pregnancy and that belly, I like to do it in a more of a seated position. So I'll sit up, I'll lean back on my hands, I'll grab an ankle, put it over that knee, and now I'm going to press into my hands, lift up that chest so that my back is nice and strong. Again, we don't want to round, so we've got a nice proud chest, and then we're just going to push into the palms so that our chest is coming towards that leg. This one feels really good. I love this one. It feels really good all down the side of the leg. Another one you can do, the figure 4, is to lie on your back. Lying on your back while pregnant is okay, as long as you're only there for a short amount of time. So you can lay on your back, grab that foot. You can hear I'm out of breath. I'm in my 3rd trimester, and it's not as comfortable lying on your back. So that's why I like the seated position more. But if you're a little earlier on in your pregnancy, or maybe your bump isn't as big, then you can, I'm still out of breath, then you can lay on your back. Like I said, it's fine lie on your back, very short periods, there's nothing wrong with it. Seated toe reach to get into your hamstrings. Now this one, again, if you've got a larger belly coming on, you're not going to be able to lean forward. It's going to put too much pressure. So you're going to have to bring your feet a little bit wider. So you can either come straight down in the middle with your feet wider. That'll help target a little bit of the inner thigh. But I'd like to reach towards one at a time, because then you're really targeting the back of that leg. You can do this from standing, but I wouldn't advise it, mainly because when we're standing and we're hinging forward, we've got 50% more blood flow going through our body during pregnancy, and that starts from like week 10. So that's very early on in your pregnancy. So if you stand up too quick, you could get lightheaded. So definitely do this one from a seated position. And then again, you want to keep your body nice and tall, hinge forward, reach towards the toe. We're not rounding so that we can be like, yeah, look, I can reach it. We're sitting up tall, hinging forward so you can feel that stretch, and that's all it is. You just want to have a nice stretch in the back of that leg. Wipers, again, getting into those hip areas. So sitting up, those feet together, and you're going to try and keep your chest facing forward. So you don't want your chest to slide to the side, and you're just going to switch those feet from side to side. I'm twisting it a little bit. I'm getting a little tight in my hamstrings. So those ones are your wipers. Getting into those shoulders and that chest area. So if you're rounding in the back, putting your feet straight out in front, and just like that figure 4 one, really, you're just going to push into those hands, and you can feel that in that front of your shoulder. Another good way to stretch this area is with your hand in a door frame. So if you're holding onto a door frame and then you kind of lean away a little bit, you'll also feel that in that pectoral. So yeah, if you're having some rounded shoulders, this is a really good one as well as a chest stretch. So a chest stretch, you can do this one standing or sitting, but you're just going to bring your arms up, elbows are at about a 90 degree, and we're going to pull them back. So again, sitting or standing up tall, you want to keep that belly button pulled in. We don't want to arch, never want to arch. So pull those arms back, and then pulling those elbows down just a little bit so you can feel that in the back, and you're going to feel it in the chest as well. It's going to be different for everyone, your feel, your tightness, wherever. So you might have your hands up, or you might have them really low. It doesn't really matter. Just finding that tight spot, and that's going to help relieve some of that chest and shoulders as well. Finally, last one is a pigeon pose. This one is quite a challenging stretch, especially if you're really tight in your hip flexors. You might not even be able to get into the position. So I'll show you something else you can do, but first I'll show you pigeon. So for a pigeon pose, if you come into like a high plank, And then you're just bringing your knee between your hands or towards that area. And then you're going to bring that back leg straight back. So this one gets more challenging as well as your bump gets bigger. I'm actually not able to get down at the moment, but you can put a rolled up towel or a cushion or something underneath this hip. That would help me out at the moment because I'm kind of falling to the side. So you want to be in that nice straight and neutral position. So having something underneath so that you can really relax into it. This one's really good. It targets that hip flexor and it also targets that low back, that piriformis as well. So I really like that stretch. But if you have really tight hips, then getting into even this position can be really hard. So if you're not able to even get your knee up, if you're really tight in that hip flexor, then I would do a happy baby. Convenient name. Now, again, if you don't want to lay on your back, you can get a pillow. If you have a Bosu, those are great to have behind you. But a happy baby, you're just going to lie on your back. And again, you can elevate your back however you like. You're going to grab those toes, and then we're just going to bring up those feet. So that helps get into those hip flexors as well. And you just kind of move around a little bit and get into those hips. So you might have to do a few more hip flexor stretches before you can get into that pigeon pose. And that runner's lunge is a really good one as well. So those are my 10 stretches. So hopefully you find some of those helpful. Again, make sure we're strengthening all down that posterior chain as well. That's going to help prevent your back pain in the first place. And stand up nice and proud. Have an awesome day, guys. I'll see you later.